Hello, my name is Amanda Pittman, and I am a family nurse practitioner student at Maryville University, and I am completing my head-to-toe assessment for my advanced health assessment class. This here is Andrea. She has volunteered to be my patient for this head-to-toe assessment. So before we begin, I had Andrea change into a gown, also had her empty her bladder. I obtained a height, weight, and a full set of vitals. I also assessed her nearsighted vision using the Rosenbaum chart and her far-sighted vision using the Snellen chart. And I washed my hands and we will begin. So to start off, I am going to do a general inspection of her skull and face. I am going to look at her face, making sure that the eyes, nose, ears, and mouth are all symmetric and even. I am looking at the color of her skin on her face, making sure it is uniform throughout. I'm also going to make sure that there are no masses present on her skull or face as well. Next, I'm going to palpate her skull. As I palpate, I'm making sure that I don't feel any masses or lesions. I want to make sure that I feel that her head is normocephalic and that her skull is freely movable. I also want to palpate her hair, making sure that it is evenly distributed throughout. I also want to notice the texture and if there are split ends or not. So next, I'm going to palpate Andrea's face. I am looking for any areas of tenderness or masses. Also palpating the frontal and maxillary sinuses. Feeling for any tenderness or pressure there. Also want to palpate her T and J. I'm going to have Andrea open and close her mouth. Okay. So while she did that, I was feeling for any clicking or popping or if she experienced any pain with that. I am next going to want to test the light sensation on Andrea's face. So I'm going to Andrea close her eyes, and she's going to tell me if she feels this equally on the parts of her face to touch. Equally? Equally? Equally. Great. So next, I will move on to assessing for cranial nerves. I'm going to have Andrea do a couple movements for me, and as she does those, I am going to make sure her face stays even and symmetric. Okay, so Andrea, can you clench your teeth? Close your eyes. Squint your forehead. Puff your cheeks. Take your tongue out. That's fine. Great. So as she did all those, her movements were even and symmetric as well. I am next going to move on to the assessment of her eyes. I will perform the general inspection first, looking at her eyebrows, making sure the texture, color, and hair distribution is even. Also making sure that the eyebrows come down through the temporal canthus. Next, I'm going to look at her eyelashes, making sure that they extend outward and upward. Once again, making sure that the hair distribution is even. I'm going to inspect the sclera and the conjunctiva, making sure there's no redness, drainage, or swelling. Also around the orbital area, noting that there's no swelling or redness. I am next going to palpate her eyelids. Okay. I was feeling for any kind of swelling once again or nodules. I am next going to use my pen light. I am going to look to make sure that the pupils are equal and reactive to light. I am going to have Andrea look at a point on the wall, and I'm going to test her consensual and direct reactions. So we're looking for direct, consensual, and once again direct, and consensual. Great, and that looks fine. So we will next perform the cover and uncover test. So while Andrea is looking at that point once again, I'm going to have her cover her left eye. And I'm looking at the right eye for any involuntary movements or nystagmus. Okay, go ahead and cover the right eye. I'm once again looking at the left eye for the same thing. Great. Okay, so I'm going to test for her extraocular movements of her eye. I'm going to have her follow my pen light here to the 6 cardinal fields of gaze. So while she's doing this, I'm going to make sure she's not moving her head, that her eyes are not involuntary twitching, or that there's no nystagmus present. Great. I am also going to test the peripheral vision of her eyes. So I'm going to cover her left eye here and have her tell me when she can see my fingers. Yeah. Okay, cover your right. Yeah. Great. Okay, so I'm now going to move on to the assessment of the nose. So with the nose, I will start with my general inspection, making sure that the nose is uniform in color and configures to the face. You want to make sure there's no masses or lesions present. I'm going to use my pen light once again. Have her tilt her head back, look at the nares, making sure the turbinates are pink and moist, making sure that there's no polyps, masses present. While I was looking, I looked at her septum, making sure it was not deviated, perforated, or that was any bleeding or crusting present. I also want to check for the patency, so I'm going to have Andrea close her left nair, her finger, and breathe. Okay, do the same with the other. Great. And she should be able to breathe evenly out of both noses. Okay, so from there, I'm going to move on to her ears. I'm going to inspect your ears, making sure that they are symmetric, that they are even in size, that they conform to the face, that the color is also uniform. I'm going to palpate the auricle, making sure that it's freely movable and free of nodules. I next would use my otoscope. If I had one, I would look into her ears by pulling the auricle up and back. I would look at the ear canal, making sure that there's no redness or swelling or drainage. And then look at the tympanic membrane, looking to make sure that it is the appropriate color, a pearlish gray. Also that there's no perforation or swelling from that as well. Next, I'm going to perform a whisper test. So I'm going to go behind Andrea, have her include her left ear. I'm going to whisper a common word and have her repeat it back.
Apple.
Okay, and your other?
Orange.
Great. So now I will use my tuning fork to perform two tests. First of these tests is called the Weber test. I'm going to strike my tuning fork, place it on top of Andrea's head, and have her tell me if she hears the tuning fork equally in both ears. You able to hear that equally?
Yes.
Great. The next is called the Rene test. This test tests bone conduction versus air conduction. So once again, I'll strike my tuning fork, place it on the mastoid bone, have Andrea tell me when she can't hear that vibration anymore, and then I will move it to the auditory canal, where once again she will tell me when she can't hear the tuning fork anymore. Okay. While I'm doing this, I'm watching the clock there to make sure that the auditory, that the air conduction is 2 times greater than the bone conduction. Okay. So I am now going to move on to the assessment of Andrea's mouth. So I'm going to look at her lips to start off, making sure that they're full and pink, making sure that there's no cracking, that they're moist. I'm going to have Andrea open her mouth. I am going to look at her tongue, making sure it's freely movable, have her move it side to side. I'm looking at the gums and the floor of the mouth as well, having her move her tongue up, looking for any lesions or signs of oral cancer. I'm also going to look at Andrea's teeth. I'm noting the color, surface, characteristics, as well as number of teeth. I am also going to have Andrea open her mouth. I'm looking at hard and soft palate, uvula, tonsils, pharynx. I'm going to have Andrea stick out her tongue, say ah.
Ah.
So while she did that, I watched the uvula rise symmetrically with the soft palate. And now I would test Andrea's gag reflex by sticking a tongue blade to the posterior aspect of the throat. Okay, so now I will move on to Andrea's neck. I am noting that it is the midline. I want to make sure there's no masses or rashes or any kind of lesions. Also want to make sure that the trachea is midline. The thyroid is not swollen. I next will palpate. Feeling for any areas of tenderness or masses. Palpating the trachea. Making sure that it is midline. I'm going to palpate the thyroid. Okay, I'm going to have Andrea swallow. Okay, so with that, I made sure the thyroid went up and down symmetrically. I'm also going to palpate the carotid pulses. And I'm also going to auscultate the carotid pulses with the bell of my stethoscope, listening for any bruise. Okay, and also auscultate the thyroid. Great. While I'm assessing Andrea's neck, I'm going to perform some range of motion movements. So Andrea, I'm going to have you bend your head to the side, and the other, in front, and back, and side side to side. So with these movements, I want to make sure that they're doesn't make her lightheaded or dizzy, or make sure it's not painful. Great. So I'm going to move down to her anterior chest and making sure that her breathing is even and unlabored, that her respiratory rate is within normal limit. I am also noting the skin, making sure that there's no open wounds, rashes, or lesions present. I'm next going to palpate the chest wall, making sure that there's no areas of tenderness, masses, or lesions. I'm next going to palpate the lymph nodes. I'm going to start with the preauricular, moving to the postauricular, going to the occipital, tonsillar, premandibular, and premental. Then moving down to the superficial cervical, deep cervical, posterior cervical, supraclavicular, inferior clavicular, and also the axillary lymph nodes. And as I was doing that, I was making sure they were all freely movable, that there were no hard nodules or areas of tenderness. I will next palpate the pericardium. While I'm doing this, I'm going to feel heaves, thrills, or pulsations. I'm also going to palpate the apical index, noting the rate and rhythm of the heart. I'm also going to palpate for tactile firmness. So as I do this, I'm going to put my hands on Andrea's chest and have her say 99.
99, 99, 99.
Great. So as I was doing that, I was making sure there were no absent or decreased vibrations in Andrea's chest. I'm next going to percuss in a uniform fashion, for symmetry and evenness. I want to make sure I don't hear any dullness or hyperresonance that would indicate any air or fluid in Andrea's chest. I'm also going to do this laterally, going from side to side, and for symmetry and evenness as well. Once again, listening for hyperresonance or dullness. Great. I am now going to listen to Andrea's lung and heart sounds. So for lung sounds, I'm now going to take a deep breath. We're going in a bilateral fashion, comparing each side. And there are no coarse lung sounds, crackles, bronchi, or wails. I'm also going to listen to the heart sounds in the aortic area, pulmonic area, Erb's point, tricuspid, and the mitral. Great. Okay, I will now move on to the posterior chest. So I'm going to have Andrea turn around for me. Alright, so starting with the general inspection, I am once again going to make sure that that her breathing is unlabored and even. There are no use of accessory muscles. I am also going to look at Andrea's skin, making sure there's no nodules, lesions, rashes, or anything like that. I once again am going to palpate, feeling for any areas of tenderness, or nodules or masses. I'm also going to palpate once again for tactile firmness. This is where Andrea says 99, and I listen for decreased or absent vibrations.
99, 99, 99, 99.
Great, and that sounded good. I'm also going to palpate for her thoracic cage expansion, and by doing this, I'm placing my hands together like this, having her take a deep breath and watching that my hands move symmetrically. Deep breath. Okay, so yes, as my hand moves symmetrically, that's good. I am now going to percuss Andrea's back, as before, in a symmetrical uniform fashion. Listening for dullness or hyperresonance, which would indicate fluid, air. I'm also going to indirectly percuss her post-vertebral ankles. This should not elicit any pain. And I also am going to percuss her diaphragmatic excursion. So to do this, I'm going to have Andrea take and hold a deep breath as she leans forward, and I'm going to percuss down. And then once I hear that difference, I'm going to mark. You can go and breathe. I'm going to make a mark. And then once again, I'll have Andrea take a deep breath, let out and hold. Same here, once I hear that difference, I'll make a mark. I will measure that mark and make sure that is within normal limits. Finally, I'm going to listen to Andrea's lungs, starting from the top of the lungs, moving down to the base. She's going to take deep breaths for me, and I'm going to listen for any coarse lung sounds, wheezes, trails. Singing in a uniform, even fashion. Great. All right, Andrea, if you go ahead and turn around and lay down for me. Okay, and now I'm going to assess Andrea's abdomen. All right, so general inspections first. I'm going to look to make sure that there's no rashes, lesions, any kind of skin discoloration. I'm going to use my pen light and look for any contour changes or any characteristics that need to be noted. I also am going to look to make sure there's no pulsations, which could indicate a aneurysm, or any bulges, which may indicate a hernia. I want to now auscultate her vowel sounds. I'm going to do this in all 4 quadrants for up to 2 minutes if I don't hear a vowel sound. Once I do hear that sound, I want to know the frequency and characteristics. While I'm here, I'm going to use the bell of my stethoscope to listen for the aortic artery, left renal, both iliacs. While I'm doing this, I'm listening for any grooves and thrills, and the femoral arteries. And now we can percuss her abdomen. I'm noting once again for any dullness, hyperreticence, that could be masses, air fluid. And I also want to percuss the upper and lower borders of her liver. So I'm going to begin at the lower, percussing up, so I hear the difference. And once again from the upper, percussing down until I feel the difference. And I'm going to do the same with the spleen on the left side. Percussing until I hear that difference there. Great. Now I'm lightly going to palpate Andrea's abdomen, feeling for any areas of tenderness or masses. And now I'm going to do a little bit of deeper palpation, feeling for her liver, her spleen, her kidneys, and her aorta. So to begin, I'm going to feel her liver. I'm going to put my left hand under Andrea's back, lift up, and palpate the liver under the rib there. Now I'm going to reach across Andrea with my left hand, remove her rib cage and pull up to feel the spleen. A normal finding would be that you do not feel that spleen. And also with your left kidney, I'm going to reach across, lift up, have her hold her breath, and feel. Also with her left kidney, it is difficult at times to feel that kidney. With her right, I'll put my right hand under, lift up and feel. Okay, and for the aorta, I'm going to put my thumb and fingers on each side. There's that pulsation. And now I'm going to have Andrea come off the table a little bit. I'm going to look at her abdominal muscles. Okay, great. Now if she was sit on the side of the bed, I will assess her upper and lower extremities. So go ahead and put your arms out in front of you. I'm looking at her skin, making sure there's no rashes, lesions, or masses. I know both sides. Feeling for temperature, that it's equal throughout, making sure the color is uniform. Looking at the nail beds, making sure there's no clubbing. No evidence of cyanosis. Making sure that capillary refill is less than 3 seconds. Same on this one. Now I'm going to palpate her brachial and radial pulses. See, I'm going to make sure that I'm going to know the intensity, the rate, and rhythm. Brachial and radial. And I want to compare, making sure that they're same bilaterally. Okay. Now I'm going to check the reflexes of Andrea's brachial and radial. Brachial, radial. We'll do the same on her left. Okay, great. Now I will test a little bit of resistance. So put your arms out and push up and down, up and down. Put your arms out, up and down. Great. So now we'll assess for lower extremities. I'm looking once again to make sure that there are no lesions or masses, that the color is uniform throughout. I want to feel for temperature, making sure that's equal bilaterally, also that there's no edema or swelling present. I'm going to feel her pedal pulses. Same at the upper extremities, feeling for intensity, rate, and rhythm. Her tibial, and also the popliteal. We'll do the same on the left, pedal, tibial, and popliteal. We'll also check the reflexes of her knees. Both sides. Achilles. Good there. I'm now going to have Andrea pushing into my hands here. Check the resistance. Push. Pull back. Pull back. Push up with your foot. Push up with your foot. Wonderful. Okay. So now I'm going to have Andrea go ahead and stand up for me. Say, I am finally going to check the curvature of her spine and have her turn around. I'm looking at her cervical spine, making sure that the curve is normal. Also have her bend over. Looking at her thoracic spine, making sure the curvature there is also normal. And that concludes my assessment. Thank you.